Hello, everyone. My name is Zoe Frederick, and today I will be presenting my oral pathology project on a condition called osteonecrosis of the jaw, or a shorter version of how to refer to it is ONJ. And pretty much, this is a very serious condition that can significantly impact patients' oral health and just obviously their overall well being as well. And throughout this presentation, I'll be going to walk you guys through just again what exactly osteonecrosis is, what causes it, their signs and symptoms, how it's diagnosed, and lastly, the role we play as dental hygienists when helping patients hopefully prevent and manage this condition. So again, what exactly is osteonecrosis of the jaw? It is a very severe condition where the jawbone becomes exposed inside the oral cavity and it begins to die due to the lack of blood supply that is in that area. It is definitely more commonly linked to patients who are taking medications like biphosphonates, which can be used for osteoporosis or any kind of cancer related issue. It can also be caused actually by radiation therapy or certain systemic conditions. And according to the American Association of Oral and Maxillofacial Surgeons, ONJ can be very chronic and it is actually extremely difficult to treat if it's not caught early on. So, prevention is huge. Um, Again, I know we kind of just discussed it briefly about the causes and risks, but this breaks it down even more. So, the most common cause is linked to patients who are taking biphosphonates. Pretty popular ones are denosumab and Fosamax. Um, and then also cancer patients that are taking medications like bevacizumab. I'm definitely not pronouncing that right. But these patients are just even they're at such more higher risk for developing osteonecrosis of the jaw. Um, Especially patients who are experiencing any kind of head or neck cancer. And then, obviously, additional risk factors will include poor oral hygiene, periodontal disease, and even certain tooth extractions and local trauma to the jaw can later on develop into osteonecrosis. So, just understanding these risk factors helps us as dental hygienists make sure that we're educating our patients during their routine dental visits if they are at risk or they do have this condition. Um, Moving on to some of the signs and symptoms that we need to be aware of. Early signs definitely include pain, swelling, or even just a small infection that's inside the gum tissue or the jaw itself. And one of the hallmark symptoms that is exposed bone in the oral cavity. And if this persists for more than 8 weeks, patients definitely may want to consider going to see a specialist to kind of determine what the proper treatment for them would be. Again, patients might also report that non healing extraction sites or even just having a numb feeling inside of their jaw is definitely a sign or symptom. And then even loose teeth is a huge actual indicator of osteonecrosis. And so, as dental hygienists, it's important for us to recognize these red flags when we do see our patients because again, it's so important for us to be able to refer them early on and so that they can get the proper evaluation that they do need. So this condition is a little bit it's intense as far as photos and things like that. So I'm going to go ahead and skip to the next two slides that just show kind of some clinical features of what ONJ might look like. And so, as you can see within these photos, the exposed necrotic bone is often either a yellowish or whitish color, and it's definitely followed by, some inflammation around the site itself. These are a couple different areas of the jaw that you can see on these patients, and it's not something that's like localized, so you won't see it in any specific area on a patient. Everybody will be different. It really is just dependent on where that patient has that lack of blood supply and where their bone is dying. So again, this patient has it kind of obviously going on in the front of the mouth, and this patient, it looks like it's up on the upper right. Moving forward to some other photos. This one, these ones are definitely more extreme cases of what ONJ can look like. And it definitely, once a patient is diagnosed with osteonecrosis of the jaw, it definitely spreads a lot faster. And so that's why managing it is also extremely difficult. Um, this is another photo here. This one is not as bad. This would kind of be a good example of when a patient maybe first comes into the office, and this is that exposed bone that may last maybe for more than 8 weeks. And so, when just discussing some of the pathophysiology and what's happening on a biological level with these patients, is that ONJ develops because the normal bone remodeling process is impaired. And so, the medications that we talked about earlier actually end up reducing our osteoclast activity in the body, and this interferes with the breakdown and repair of bone tissue. And so when this is combined, it reduces the blood flow and potential local infection. Um, and again, the bone begins to die, which undergoes necrosis. So another thing to kind of keep in mind too is that once the bone is exposed to the oral environment, it's a lot more vulnerable to further breakdown and bacterial invasion because it's pretty much an open wound inside of our mouth. So when it comes to eating and chewing and things like that, it can be very difficult to for a patient to keep that area clean. So when it comes to diagnosing patients with osteonecrosis, it's actually a very large clinical aspect. We definitely will consider the patient's medical history and their medication history. We'll conduct our thorough oral exam, and radiographs are actually a huge thing to help with in these cases, especially when a patient is diagnosed with osteonecrosis. It's important to kind of maybe update radiographs more often so that you can kind of manage and see just the changes in bone and how fast. You might also see irregular bone patterns or areas of necrosis, and that is actually called sequestra. Um, the biggest thing, though, when it comes to diagnosing patients is that, you have to kind of rule out similar conditions like metastatic cancer, osteomyelitis, or osteoradionecrosis, because all of those actually present in very similar ways as ONJ does. Um, Moving forward, when it comes to just the staging of ONJ, it is actually divided into four different stages. And stage 0 shows that there's no exposed bone, but the patients may start, they're starting to have very vague symptoms, obviously, maybe more of the pain and the swelling. Stage 1 involves exposed bone that doesn't cause any pain. Stage 2 includes the exposed bone, but it is accompanied by pain and infection. And then stage 3 is the more advanced one with complications like bone fractures or even sinus tract formation. Um, and so these staging, it just helps us guide through the treatment plan. So it's important for us to understand where a patient does fall on this scale, and when and how and where we refer them. Um, and then again, kind of moving on as far as treatment options, they also break down the treatment for osteonecrosis into different stages. And so stage 0 is typically only maybe required. It's more monitored with antimicrobial rinses and antibiotics, just to kind of help flush out the bacteria and see how the patient responds. Stages 1 and 2 often involve removing any of the infected bone and just managing the pain and an infection. Stage 3 requires definitely a lot more aggressive surgical treatment, like resection, along with long term antibiotic therapy. Pretty much, though, no matter what stage of osteonecrosis a patient does have, pretty much just pain control and infection management are going to be the most crucial just to help with patient comfort and obviously, hopefully, slowing the disease progression. As far as prognosis and prevention, Prognosis really depends on how early the condition is caught and whether or not the patient sticks to their treatment plan. Prevention, again, is huge when it comes to this condition. And before starting medications like biphosphonates, patients should have a thorough dental exam and even a cleaning. And because we also want to avoid any kind of extractions, traumatic procedures during their therapy, and just having regular dental maintenance and excellent oral hygiene can definitely make a big difference when trying to prevent ONJ or even just catching it early. I did add this slide in here because as dental hygienists, we're not exactly on the forefront when it comes to identifying potential cases of ONJ, but we may see patients. So it is also very important for us to be aware of what these signs and symptoms are and just the risks and things that they're linked to. The biggest thing for us as hygienists is that we can educate our patients about the risks of their medications that they're taking, especially those with cancer or osteoporosis. And it's definitely also our job to help coordinate with the rest of their healthcare team to just help ensure that the patients are receiving safe and adequate care. Um, and so, when it comes to just the overall conclusion of osteonecrosis, to wrap it up, of the jaw, it's a serious and often preventable condition, but it's hard to prevent. But our role as dental hygienists is essentially identifying any at risk patients and being able to educate them about just side effects, but also helping them maintain their oral health and hopefully reduce any further complications. Staying vigilant and informed with our patients, it can also help avoid them having a lifelong problem with pain with this condition and sometimes also life altering consequences. And so, again, this is another reason why being a dental hygienist is so important because when we notice these signs and symptoms, it is crucial for us to be able to educate and make our patients aware. Just to kind of wrap up again, this is the long list of references, and I appreciate you guys for listening. Thank you.